Hello medical terminology class. I am doing my presentation on pulmonary embolism, in which I will refer to what is pulmonary embolism, what is its pathophysiology, the signs and symptoms associated with it, the complications which occur in the body because of pulmonary embolism, the diagnostic test, and how we should approach to this condition. So first of all, what is pulmonary embolism? Pulmonary embolism is the blockage of pulmonary arteries by a thrombus, fat, air embolus, or a tumor tissue. The risk factors which are associated with pulmonary embolism include immobility, surgery within the last 3 months, history of deep vein thrombosis, malignancy, obesity, heavy cigarette smoking, and pregnancy too. Approximately 10% of patients with PE die within the first hour. An additional 30% die from recurrent embolism. Treatment with anticoagulant reduces the mortality rate to less than 5%. The pathophysiology associated with PE includes most PE arises from DVT in deep leg veins. Venous thromboembolism is the preferred terminology used to describe the spectrum of pathological conditions from DVT to pulmonary embolism. Lethal pulmonary emboli most commonly originate in the femoral or iliac veins. Emboli are mobile clots that generally do not stop moving until they lodge at a narrowed part of the circulatory system. Because of higher blood flow, the lower lobes of the lung are commonly affected. Pulmonary embolism requires a medical diagnosis, but the symptoms can include shortness of breath, chest pain, and cough. People may also experience lightheadedness or low oxygen in the body, fast heart rate or palpitations, fast breathing or shortness of breath, and it can also lead to fever, chest pains, which can be worsened by breathing or dry cough. There are various other complications which comes along with pulmonary embolism. The first one I mentioned here is pulmonary infection, which can lead to occultation in the large or medium-sized pulmonary vessels, which in turn leads to insufficient collateral blood flow from the bronchial circulation. Pulmonary hypertension can also be associated as a complication of pulmonary embolism. Dilation and hypertrophy of the right ventricle is often seen in cases of pulmonary embolism. The other very common complication which occurs as a result of PE is alveolar necrosis or hemorrhage in the pulmonary vessel. Proper diagnostic tests are required for pulmonary embolism. History and physical examinations are often kept in mind before doing any further diagnosis. Chest X-ray, continued EKG, venous ultrasound, pulmonary angiography, D-dimer level are some of the tests which doctors use to diagnose pulmonary embolism. Nursing management is a vital part of how to approach this disease. The nursing care should be emphasized and focused on prevention of emboli. There should be proper and accurate cardiopulmonary assessments. Patients should be required to do bed rest. Nurses should monitor for any complications of anticoagulants and fibrinolytic therapies. Patients should be provided with emotional support and reassurance. Along with nursing management, patient teaching is really important. Patients should be well aware of the fact that anticoagulant therapy continues for at least 3 to 6 months, in which they have to limit their alcohol intake to small moderate amounts. Not only this, they should avoid all aspirin-containing drugs. It is the responsibility of patient to inform all healthcare professionals, including dentists, of anticoagulant therapy. Pulmonary embolism is a really common disease with 200,000 cases per year in the United States of America. It is deadly, but proper diagnosis on time can lead to its treatment as well.